Welcome back. Well, today I am joined by Dr. Amy Bremner, who is here on behalf of MemorialCare Saddleback Medical Center. Well, Dr. Bremner, thank you for joining me today.
Thank you for having me.
Now, we've talked to a lot of doctors from MemorialCare about breast cancer in the past. And of course, we've been doing this show for a very long time and lots of doctors. Nonetheless, we understand that you are the medical director for the breast surgical oncology over there at the medical center. Tell me a little bit about some of your responsibilities.
Okay. Thank you for having me. I appreciate it. Yes, as you said, director for the surgical oncology practice here at MemorialCare. I actually practice in the Laguna Hills location, and I've been here for about 6 months now, and have been practicing for about 12 years. Actually came from Temecula, and now am happy to be here in the Orange County area. And my duties essentially are to build this program into something great and reputable, and to provide quality breast cancer care here to the MemorialCare patients and the community around us. And they have been providing great care. We're just looking to expand on that and build on that, and especially with our new women's center coming, it's of the utmost importance. So we're very excited.
Now, you had mentioned off camera that you were with Breastlink. So then, of course, you mentioned Temecula. So I visited that location out there. Were you out there for the majority of your career prior to where you are now?
Exactly. Yes. I started out there. I joined Breastlink, had the option of coming to the Orange County location or the Temecula location, and chose the Temecula location because they really did not have a lot of, well, actually they had no breast surgeons in the area, and built that program up pretty much from the ground up. And yeah, so I've been there for about 12 years, and then decided to make a move, and excited to be in the area.
Okay. So when you first decided you were going to become a doctor, was breast surgery always something you were interested in?
I always knew I wanted to be a doctor. My dad is a retired psychiatrist. I knew that I wasn't interested in psychiatry. However, I did major in psychology, but didn't make the decision about exactly what specialty I was interested in medicine necessarily until I got to medical school and really tried everything out.
Mm-hmm.
But my interest has always been in women's health, and I've always thought I was going to OBGYN. So when I went to Georgetown for medical school, went through all of our rotations, and one of my last rotations was on a general surgery rotation, and really liked my mentor, and changed last minute actually, and decided to go into general surgery. And so spent 5 years doing general surgery, and throughout that process still gravitated towards women's health. And so breast cancer was an interest of mine, and so pursued then a fellowship in breast cancer surgery.
So you're still very active in helping patients with breast cancer. You're not just the medical director. So at what point would a patient want to see you or get to see you?
Yeah, I mean, good question. I actually am extremely involved in patient care, and I'm not at all ready to give that up, that's for sure. And so I see patients from many stages of their journey, from the beginning when they may have a complaint within the breast, a breast mass, or some sort of skin changes, something of that sort, where they come in and we actually do an exam and order imaging and diagnose the breast cancer that way. Most of the time they come to me after they've had their, say, screening mammogram, and something's been picked up on their mammogram, and they've had their biopsy, and they come to see me for options.
Okay.
And then finally, I do see patients throughout their course. So sometimes patients have been diagnosed or undergoing chemotherapy, things of that nature, and they'll be referred to me to then talk about surgical options.
Okay, awesome. And then what is the most common type of breast cancer?
I mean, there's many types of breast cancer. I would say, there's two types, actually two most common types. One of those is called invasive lobular carcinoma. The other type of breast cancer is invasive ductal carcinoma. Most commonly, we see the invasive ductal type, but we see many different varieties of breast cancer, but those tend to be the two most common diagnoses that we see.
Okay. Now, those particular types, can those be detected on a PET scan?
So PET scan normally isn't the imaging modality of choice to begin with. And so, yes, can PET scans pick up Breast cancer, definitely. Usually PET scans, however, are used in the staging process after the breast cancer has been diagnosed by better imaging modalities such as mammogram, ultrasound, and breast MRI.
Okay. Okay. Good to know, because sometimes you hear a lot about PET scans, but then
Right.
you think, well, you go into the doctor and go, well, I want to get that, but then that's really not the right term to use or the right procedure. Now, there have been a lot of changes in technology over the years, and I'm imagining that breast cancer isn't, far behind when it comes to cosmetic procedures that help enhance what's been going on. What are some of the latest developments there?
How I trained was in something called oncoplastic breast surgery. And oncoplastic breast surgery really combines oncologic cancer principles, healthy tissue around it, completely removing the cancer, as well as then using plastic surgery techniques in order to give the patient the can. Because we know that women obviously want the best cancer operation. We want to save lives is our primary concern. But additionally, we want patients to feel good about how they look after their surgery, right? We want them to go on feeling like, hey, I actually look great after my cancer surgery. It may not be a constant reminder, and maybe I even look a little bit better. So that's the kind of our focus, and that's not necessarily a new technology by any means. Oncoplastic breast surgery has been around for a bit. However, it is newer, and that's now, how breast fellows are being trained.
Got it. Well, it's nice to be able to have a complete solution rather than, oh, well, we're going to do this, but then you have to come back and we'll do this. I mean, it sounds like it's all very well thought out. So that's good for the patient for sure. Now, because of COVID-19, there have been several changes in the way offices are prepared, surgery centers are prepared. What are some things that you guys have done to change the way you do surgery now?
At the height of the pandemic, which was a scary time, things changed quite dramatically. There are times where we couldn't actually take patients to the operating room. We had to hold off on surgeries unless absolutely necessary. And so at that time, and even today, we have ways in which we can treat patients, perhaps not surgically if we don't have to go to surgery right away, based on medications, things like that they can be given prior to surgery, where that actually even stops or slows the progression of the cancer. And so we can kind of hold off on surgery if necessary.
Mm-hmm.
Now, obviously times have changed now and things are lightening a bit, and we've been able to resume normal operations as far as surgery goes. But, clearly in the era of a pandemic, we need to be careful and cognizant. So there's obviously our normal routine testing, et cetera, to make sure patients are safe when they go to the operating room, when they do.
Awesome. Well, I appreciate all of that information. It's great stuff. And then what are some things that people can do to help prevent breast cancer? I know it's not always easy. Most people, or most doctors, I should say, recommend so many different things that are very similar as to what we can do to prevent all cancers.
Yeah. So, unfortunately, if we knew exactly how to prevent breast cancer, we could eradicate breast cancer, which would be fantastic. But, the risk of breast cancer, there are multiple risks associated with breast cancer development, some of which we can control, some of which we can't control. So the one we can't control are, family history and genetics, things like that, where we're born with those things. And so we can modify those things.
Mm-hmm.
The things that we can control are things such as weight, alcohol exposure, hormone exposure, things like that. So most of these factors deal with estrogen or progesterone or hormone exposure. So ways of limiting that is always helpful. So for instance, hormone replacement therapy in some women may be necessary, can increase your risk slightly. Now, we don't recommend that no person can be on hormone replacement, but those are some things to think about if you're a high risk patient. Do you want to go into hormone replacement? How can you outweigh those risks and benefits associated with that?
Right.
Weight, for instance, elevated body mass index or BMI can be associated with an increased risk of breast cancer. So clearly we always are talking to patients regarding a breast cancer risk. Just overall health, keeping your BMI to a lower level is healthy in so many ways.
Yeah.
Even exercise has been shown in some studies to decrease breast cancer risk and recurrence of a breast cancer. And we may think clearly that that's related to your weight and your BMI. So a lot of factors I think patients come in quite often asking about special diets. Should they avoid deodorants? Should they avoid water and water bottles, things like that? So I think that there are a lot of myths out there as far as how to prevent breast cancer. And I think mostly what I say to patients is everything in moderation, a healthy lifestyle, high fiber, low fat, avoiding processed sugar,
Yeah.
being organic. So those kind of healthy lifestyle changes can help, tremendously with breast cancer.
Fantastic. Well, thank you so much for the information. I really appreciate it.
Problem. It's nice to meet you.
Nice to meet you too. If you want more information about what we have just discussed, you can always go to memorialcare.org/SB breast. We'll be right back.